The COVID-19 public health emergency officially ends tonight at midnight. The change comes days after the World Health Organization ended its global health emergency regarding the virus. The biggest change some may notice is in Medicaid coverage. People enrolled in the program could not be eliminated during the pandemic, but those guidelines are now ending, meaning as many as 24 million Americans may lose their coverage and would need to reapply. Although the emergency is over, that doesn't mean that COVID is no longer a threat.
So here's a timeline of the past 3 or so years of the pandemic. On January 20th of 2020, the CDC confirmed the first case of COVID-19 here in the United States. And then 10 days later, the first recorded case of a person-to-person spread, again here in the U.S. Then March 11th, the WHO declared COVID-19 a pandemic. Now that takes us to May 28th of 2020, where the number of COVID deaths in the U.S. surpassed 100,000. 2 years later, on June 1st of 2022, the known death toll from COVID passes 1 million in the U.S. And today, 38 months after declaring it a worldwide pandemic, the WHO says COVID-19 is no longer a public health emergency. News 19's Walker Lawson has more on how our frontline workers are feeling as this public health emergency is ending.
High stress, uncertainty, and fear are the emotions nurses have faced since the pandemic began.
It was a very scary moment.
Dwayne, Aline, and Jules Scott are both nurses who worked on the front lines of COVID-19 in the Carolinas.
We were in PPE, head-to-toe gowns, masks, in 95-degree plus weather. So I just remember the heat.
Scott and Aline said with long hours and uncertainty on a daily basis, it led to a roller coaster of emotions.
There was a lot of appreciation for the healthcare workers. A lot of people said, thank you for what you do. People respected me because I was one of the few people that actually had to go to work. A lot of people were able to stay home, but they knew I had to go. So I had a lot of respect when people said, I feel proud of you and stay safe.
While trying to take care of others, they face difficulties in their own families, battling with loved ones passing and missing out on family events.
It's somewhat underappreciated the amount of toll it took emotionally on people's mental health, working through the pandemic, taking care of patients, and seeing more people die than we're accustomed to seeing in such a short amount of time.
And thanks to research and mitigation efforts, the public health emergency is ending. And now the two feel called to pass on their knowledge to the next generation of nurses, while also finding ways to make sure the shortage ends.
We're seeing some of the effects now with the nursing shortage and thinking about what do we need to do to prepare the next generation. Fortunately, today we're here part of the Stand Up SC program, which is really working to increase the racial ethnic diversity of the nursing workforce, as well as preparing people to have those conversations of how do you take care of yourself while being a nurse and caring for others. And that self-care piece is important.
In Columbia, I'm Walker Lawson, News 19 WLTX.
All right, so now let's break down what changes you can expect to see when the public health emergency ends tonight at midnight. If you have symptoms of COVID-19, DHEC says they are still offering free take-home COVID tests. Since DHEC is a statewide agency, these kits are available at several clinics. You don't need an appointment to pick up a kit, and DHEC officials say the kits don't expire until next year. All you have to do is check DHEC's website to find a clinic that's close to you, and for more information on the end of the public health emergency and what it means, just look for the story on our website at WLTX.com.